Hey everyone, it's Chris Burfield, and I've got Christina Troja here today from Troluna Inc. And I've got some really exciting news for a lot of you that are using DME companies and maybe not getting paid from certain insurance carriers. I was talking to Christina a little bit yesterday, and she told me that she has finally cracked the code and has got insurance carriers that weren't paying for DME services at one point to actually start paying her, start paying Troluna. So her doctors are so freaking excited right now because they've had a ton of patients that were with this carrier, and now they're actually going to be able to start getting paid. So Christina, thanks for coming on this call today. I appreciate it.
Sure, thanks for having me.
So tell us a little bit, just the backstory on this. I know yesterday you said that it's been it's been a while since this particular carrier has actually paid anything on DME services, and you've finally been able to start getting them to pay. So can you tell us a little bit about how you cracked the code, if you will?
Sure. I mean, I did my homework. I've been doing some research, and there was a period of time for about a year and a half where there was an insurance that used to be fine, and all of a sudden they just stopped paying for different types of DME. And recently, for the past several months actually, we've been having major success with this company again. And, doctors that were once not able to prescribe any kind of durable medical equipment for these patients that had this insurance are now able to do it again. And just this past weekend, I was talking to a doctor that I had met at a convention, and he actually was using another DME company. And we got to talking, and he was telling me about the same issue that he was having at this other DME company. And I've just explained that, we take most major medical insurances, and this happens to be one of them. And he was so ecstatic that he literally immediately signed up with us. And he said that he has like 30 patients back home that he's been wanting to give different equipment to, like TENS units and back braces for these people that need it. And he just wasn't able to do it because they couldn't afford any of the extra out-of-pocket to just buy the equipment outright, so he wanted the help of the insurance company, and he wasn't able to do it. So I talked to him for a few minutes about how, the success that I found with the research I've done, and he started filling out the paperwork and sent it over, and it's just been awesome. We're getting these people the equipment that they need, and everybody is ending up happy. The doctor, the patient, everybody's really happy about it.
That's awesome. Now, from my understanding, this isn't happening like with every DME company. Like, you were able to figure out, you specifically, your company, what needs to be done in order to get these claims paid on. And other docs that are using other companies, I'm going to recommend that, if they're using other companies and they're not getting paid on all the claims from, especially this particular insurance carrier, that maybe they take your 3-patient challenge and send you 3 patients that deal with this specific provider and say, hey, here's 3 patients, what can you do for me? And I know that once they use you, and because all the docs that I've recommended to you, Christina, have spoke very, very, very highly of you. I just talked to Dr. Lipinski the other day. I'm actually going to have him on an upcoming Skype call so that he can talk about his experience. He's ecstatic about the amount of customer care and service that he's getting from you and your team. So I'm going to recommend that docs take this 3-patient challenge with you, to call you today and find out who this insurance carrier is specifically. We don't want to mention any names, but find out who it is. But it's one of the big boys, and take your 3-patient challenge and see what you can do for them. So if they wanted to get in touch with you, Christina, how would they go about doing that?
Definitely give us a call today, 412-249-8493. Or you can always check out our website, www.troluna.com.
Oh, that's awesome. And one last thing, it's my understanding that doctor that you talked to at that convention, he had something like 30-plus patients that had this particular insurance carrier that he was like, I can send these to you right away. So that's another thing I'm going to recommend. When docs find out and they take your 3-patient challenge, that they go back through their records and they find the patients that needed this equipment, but just like you said, maybe couldn't afford the out-of-pocket cost for it, and get those patients some help. So anyway, thanks for being on the call again. I appreciate it. In the meantime, everyone, keep saving lives.